Subscribe to Morris TVGH.
Reported cases of COVID-19 across the country. We have mainly workplace and school outbreaks. Some schools have closed down temporarily to control the spread. Other companies have also taken a little break to ensure that they are able to contain the spread. The Omicron sublineage BA4 and BA5 are driving the current increase in cases. We have reported 4 new deaths from COVID-19. The number of monkeypox cases has gone up. But the last one we picked was about a week ago, and then the vaccination drive is also picking up, which we'll share with you. Total number of confirmed cases for COVID-19 so far stands at 164,843. We've done nearly 2.46 million tests. About 161,000 of the 164,000 plus have recovered, with a total death of 100,448, which means that in the last few days we reported additional 4 deaths since the last time we had deaths. The active cases is now 1,417, and currently we are having severe cases and 14 severe cases and 3 active cases for COVID. In the next slide, just is the usual slide. You can see the 4 waves. Now we have a little increase that is going up, and we need to be very careful before it becomes a full-blown wave. So if you look at the next slide, it actually depicts the number of cases that were happening in April and May till now. So you can see that we have the cases, and then we also have the contacts tracing that is being done to catch up the cases. So you can see that there is an upward, we have a little drop, but it's still on the average. There's an upward surge slowly as it goes to days come by. If you look at Greater Accra, which is the main driver of the new cases, you can see that between March and early April, it was quite silent, but it has been since May, we've seen a rise. So if you look at the graph, you can see there is gone up. There seems to be a little plateauing, but that is maybe a temporary one. So we shouldn't take that one serious, but we want to ensure that we bring it down. So you can see that the active case is also going up across the country. What is interesting is that if you look at the active cases by age, we have the usual 30, 25 to 59 as the bulk of the cases. But you can see now for the first time we are having some increases in the under 15. That's 10 to 14. 0 to 5 used to be less than 1%, but now you can see the numbers are going up as far as the cases are concerned, of the active cases. So that tells you that we are also having some challenges with the kids, and that is where that's the group that's unvaccinated, and that's why we're having some outbreaks in schools. It still is a generalized outbreak. We still have regions that do not have cases. But if you look at the top 20 districts that has active cases, you can see that Ayawaso, Greater Accra account for the largest number. About 10 out of the 20 are all districts in Greater Accra. We have some in Ashanti, it's Kumasi. We have Central, Ahafo, Bono East, and Eastern region. So half of all the cases, and if you rank them in terms of the highest, you can see that Greater Accra still tops, apart from New Jabin, that just pops up in the middle Most of them are all Greater Accra districts. I think it goes on. And the communities and this with about 10 or more also comes up in the next slide. If you look at the active cases by region, it's nothing, it hasn't changed much. The same large number of Greater Accra is being affected. Ashanti, Eastern, Bono East, Western and Central. Then mainly the Middle and Southern Belt is where we have majority of the cases. And with the lowest, OT has 1 active case, Savannah has no active case, Upper West has 5, Northeast 4, Upper West 4, Bono 20, Ahafo has 8, and Western North has about 10 active cases. So if you rank the regions into low, medium, and high, the region with low caseload is Savannah, OT, Northern, Northeast, Upper East, Upper West, Ahafo, and Western. That's about 9 or so, 9 of the regions. We have medium, then to 50 cases, Western, Volta, Central region, Bono East, Ashanti, and Eastern. And the highest, those in the red group, is Greater Accra. So Greater Accra always stands out, and so a lot of the drive of the spread is also coming from Greater Accra. So what is happening in Greater Accra? There's been a gradual increase in number of COVID-19 cases across the Greater Accra region over the last 1 month. We have an average daily cases of, that has increased from 1.3 in April to 13 cases in May and to 133.1 cases per day in June. So you can see 1.3, 13, and then 133. So in June, the number of cases being reported in Greater Accra is fine. It's very, very high. Of course, there's a lot of testing now. There's a lot of contact tracing to ensure that all cases are tested and isolated. And 20.8% of the cases in Accra are children between 0 and 15. And so last time we came, it was 18%. It's edged up to 20%. And so something has to be done as far as the protection of children are concerned, because they are also not vaccinated to give them the protection they need. So what is driving the surge? Of course, is the new variant BA.4 and BA.5, which is part of the Omicron sublineage. Adherence to the protocol, as we are all aware, is very low now. Even in this room, I can count the number of people who are not wearing masks. I just took mine off, so don't count me. But we can see that we still have, previously we will not find anybody in this room not wearing masks. But now I can pick about 5, 6 people who are not wearing masks. And so that the hand washing, the social distancing, these are all extremely relevant that we stick to it. All the system that we put in place in workplaces to make sure doors are open, ventilation is improved, people are washing their hands. Where necessary, doors should be opened. Mass gathering to eat can be curtailed. All these things are still very relevant, especially in Accra. But of course, if you don't take these measures anywhere, you can move from 8 cases, active cases, to 1,000 in a very short time. The booster uptake is also now. We have booster doses for every Ghanaian who is eligible for vaccination, but the number of people who are taking the booster is low, and we are urging that people should take the booster, because after a few months of the vaccination, the antibodies come down, and so taking the booster is very, very useful and very helpful. We are also in a seasonal flu season, so this is a time where transmission is faster, and so also it's part of the reason why we are. So the most important thing is the adherence to the protocol. We can't change the seasonal flu season. The lineage, the variant of the Omicron is around, and so we need to take care to make sure that we really apply the the protocols as much as possible. We know that there are about 13 schools that have reported outbreaks, but we also know that there's a lot more than 13 who have not reported. We've had 245 cases among these 13 schools. 134 have recovered, around 111 are still active, they are still waiting to recover. The good thing is that we've not had any deaths among this group. So if you look at the next slide, these are the spatial distribution of the schools. They are all around the same Accra Metro and its environs. And so you can see that we need to really be careful in this zone. For the active cases in Greater Accra, 749 of them are mild or asymptomatic. They don't have any symptoms. They are just positive and they are very mild symptoms. 19% of them are moderate, severe 13, and critical is 2. Because of the vaccine, Greater Accra also has probably one of the largest population vaccinated. You can see that we are not having the usual distribution of having more severe and critical cases. But it's also possible that also this variant is not a very severe, it doesn't cause severe disease. And if you look at the age distribution in Greater Accra, we are focusing on Greater Accra because it is the main driver for the infections that spread to the other parts of the country. You can see that we used to have less than 2% for 0 to 5 years. We are now doing about nearly 5%, 4.7. 6 to 10 is 5.9%. 11 to 15 is 6.2%. That comes to nearly 20% of those who are infected. But previously, we are not getting that group infected. And of course, the same goes as the usual. So what have we done so far to reduce the control, bring some public health measures to ensure that we bring this outbreak under control? We have enhanced education on adherence to wearing of the face mask, especially in enclosed spaces such as classrooms and workplace settings. And so we also are aligned to the recommendation from GMA and GRMA as far as these are concerned. We also got in GES to issue a circular that says that all students should wear masks in their classrooms, and all the measures that were put in place to ensure there's no mass gathering in schools have been done. We have also sent additional staff to the schools to ensure that there's good surveillance and we're able to quickly respond when there's a case so that we can contain the spread. We are also intensifying the vaccination of all the eligible population and administration of the booster doses for those due. We have also made Ray apply to our NITAC to ensure whether we can give vaccines to those between 10 and 14 so that we can also increase the number of people who take vaccines. We are doing very active school surveillance because that's becoming a major priority. It's not only Ghana, there are many places where the youth is becoming the bride, but they're the least vaccinated and they're also the most active. So we can enhance our surveillance in schools and for the youth to ensure that we are able to identify them early and isolate. And we continue our safe verification on ventilation practices, indoor spaces such as schools and workplaces should ensure that these measures are taken. We have reported 4 deaths, as I mentioned earlier. We have a 43-year-old female, a 63-year-old with a comorbidity, 18-year-old male with who also had pneumonia on top of whatever he got, and then the 83-year-old. So these are the deaths that we have had. And this is just the, and these are all, I think 2 are in Accra and 2 are in the Eastern region. That's where we have the cases. So far, we have received, so let me talk about the vaccination part of the response. So far, we have received 32 million doses of vaccines. nearly 33 million since we started doing vaccination. We have distributed 25.4 million doses to the regions, and we still have stocks in the regions. And the national stock, we have 7.4 million doses of the various types of vaccine available for redistribution as the stocks in the region run out. So far, I think the last time we were here, we had done about 15.3 million doses. We are now doing about 16.75 million doses. So the drive is picking up. The campaign has worked. About 52.2% have received at least a dose, and then about that accounts for about 32.9 million percent of the total population. We have had about 7.1 million, which is about 36%, who are fully vaccinated, and then 22% fully vaccinated if you project it to the total population. So the vaccination coverage is increasing, but I wish it was faster, so that as the virus decides to stay with us, we also decide to be all protected and not have a spread. Incidentally, when you look at the vaccines, you can also see that where the population, the larger population is vaccinated, is the region that also has the least cases. Of course, maybe the southern part has a more populous situation. So when you come to Greater Accra, is not doing well, not doing too badly. They are green, but Eastern, Ashanti, Western North, Ahafo are still not doing too well in terms of the population that are fully vaccinated. The last time we came here, I mentioned that we have about 90 districts that are doing less than 25% of the population vaccinated. Now the number has dropped to 73. Some districts have had their numbers pop up to. So we have 73. We are hoping that by the time we come here, it's 0. So that at least every district have had at least a certain proportion of the population vaccinated. So the number of yellows have reduced, and we continue working hard to ensure that we don't have any yellow and we have more deep greens across the country. We still, for the school vaccination, is still ongoing. We've done about 379,834 cases, and Central, Eastern, and Greater Accra seem to be doing much better. And then Ashanti has probably the largest population of school students in that population, but we still have only 20%. So we are going to make sure that in this campaign that we are doing, we also focus on them to make sure the numbers also go up. So if you look at the total number of vaccination per month, we got as much as 5.9 in February. It dropped to about 0.83 in May, but in June we are midway, or a bit midway. We are reporting midway, and we are doing about 1.26. So we are hoping that by the end of June we will have peaked a bit more above where we were. Maybe we come to the March figures, and then we can also continue to increase the number of cases that we are vaccinating. As we used to have a challenge of vaccines, now vaccine availability is not the problem. We're actually having to manage the cold chain, having to manage the supply chain to ensure that we don't have more vaccines in the system. So we are saying wait and deliver. So we are now scheduling the delivery because we have enough vaccines for everybody. We still have a significant challenge as far as hesitancy is concerned, especially in the areas where the cases have not been high, where people feel that they don't see themselves at risk, and so convincing them to take the vaccine is a challenge. But that is where, when you have a new surge those are the places where you're going to have more people getting sick because they are not protected.
Thanks for watching. Please like, subscribe,
and click on the bell for more updates.